For this week's dental segment, we're going to talk about an issue called T.M.J. Joining us now is Dr. Bruce Goeringer from Goeringer Family Dentistry in the Back Mountain. Dr. Goeringer, nice having you on the show today.
Good to see you again, Dave.
Well, let's talk a little bit about this T.M.J. What is it? What does it stand for?
Well, T.M.J. is just an abbreviation for temporomandibular joint. It's the jaw joint. It's where the mandible, the lower jaw, joins the base of the skull, the upper jaw, and there's a complicated joint that allows the jaw to move the proper directions that it needs to move.
So this is caused by what? What are some of the things that would lead someone to have this issue?
A temporomandibular joint disorder is generally caused by wear and tear. If you're putting inadvertent stress on the joint, it's going to break down. There's a capsule of fibrous connective tissue and elastic connective tissue that surrounds this joint. It actually encapsulates both the upper and lower joint. And there's a cartilaginous disc, a disc of cartilage that fits in between those two joints, or the bone on those two joints, and it allows those joints to ride over each other so that there's no bone-to-bone contact.
All right, so as far as this happening, what are some of the reasons why you would have a disruption by clenching and grinding of teeth?
Well, if someone is under a great deal of stress, they tend to grind their teeth, particularly nocturnally. They're not even aware of it, but if they're under a lot of stress, they'll do that, and you'll tend to wear the joint down faster that way. Also, we spoke about this last week, if you lose posterior teeth, the relationship of the joint changes because the vertical dimension, which we spoke about last week, also changes, and that relationship of the two bone, the bone on the lower jaw and the bone on the upper, is not what it should be. And you get wear and tear of that cartilaginous disc, and you could get wear and tear of the capsule as well.
So what are some ways that you can go by treating this? What treatment options are out there?
Well, the simplest way to treat it, and it really needs to be done sooner rather than later. If someone starts to have pain in the TMJ, we can use an opening appliance, an appliance that will actually open the jaw and restore the relationship, the original relationship of the jaw, and allow that cartilaginous disc and the capsule to be in the proper position. And that way you get less wear and tear. It takes the stress off of that area, and you'll get less pain.
All right, Dr. Goeringer, tell us a little bit about your practice. You're located in Dallas, the Back Mountain of Luzerne County. What are some things that you do?
Well, we treat, we're a general dentist. We treat all phases of dentistry, from restorative to root canals, endodontics, dentures, replacing missing teeth, crowns, and anything we can't handle, we have specialists that help us out. But we treat a wide variety of ailments.
So you're a dentist that does it all. For our viewers that are looking for an appointment, and we know you try your best, they need to set something up with you. How can they get in touch with you?
Well, on the screen you'll see the phone number. It's 570-675-3646, or my website is drgoeringer.com.
All right, Dr. Bruce Goeringer from Goeringer Family Dentistry in Dallas, thanks so much for being on the show.
Thanks a lot, Dave.